Hello, everyone, and welcome to OT Echo. Thank you so much for your commitment to continuing education. My name is Kate Barlow. I am the founder and chair of OT Echo. And today, April 10th, 2025, we have Dr. Karen Duddy here to talk to us about artificial intelligence. I'm so excited. She is a personal friend of mine, so please give her a warm welcome. Please remain on mute for the duration of the presentation. And when we go into breakout rooms, it would be great if you could leave your camera on. And as a reminder, you need to complete both the pre and the post survey in order to receive a certificate of attendance. Let's get started. Thank you so much, Karen, for joining us.
Thank you. I'm very happy to be here and talk about one of my kind of favorite obsessions currently, which is artificial intelligence. And I've been playing with a lot of tools to figure out how it can benefit myself, my colleagues, both in scholarship and in practice. And I'm trying to pay attention to a lot of environmental concerns as well, because AI is pretty new. And so we're learning about the impacts not just on people, but on the planet that we populate. So we'll talk a little bit about some of the basic AI tools, which I have found to be most effective, really, with applications in occupational therapy. And I'd like to share some of those uses with you. And some of the things I wanted to emphasize was how we could use this to really help us create more practical home exercises, things that using things that people would have around their house. We know that it's difficult to go out and purchase a lot of therapy equipment. So we want to pick the right things, using the right tools that are accessible. And I found that AI can help with that a lot. And then also getting some information about conditions or, again, some treatment ideas on the go when we're in the clinic, like maybe right before a session or thinking about the next session. And then also touch upon how we can best use AI as a thought partner. And part of that is being able to input good information so that we can get so that AI can generate responses that are useful to us. So, but first, before we get into that, a quick poll. I am interested in have you, not how have you, but have you used AI, whatever that means to you, in your OT practice before? So we'll take just a few minutes there to see. So it looks like, ah, good. We've got about 2/3 or so that have. That's excellent. Good. Okay, let's see. All right. Yeah, I was thinking that have you, but we'll the have you question versus the confident question. But I'm going to keep this in mind. All right.
I realized I launched the wrong one, Karen. I'm sorry.
Yeah, that's okay.
Sweet. Oh, it won't let me launch that one.
Oh, that's strange. All right. Well,
Let's see.
I kind of like the confidence right out of the gate, though, actually. Okay. This is awesome. Good. Well, I remember what the confidence question was, so we'll see at the end if it's different at all after we go through this. All right. I love it. Thank you guys for being very responsive to this poll. It's helpful to know, AI is such a new thing, but yet it's not. It's been around for a couple of years, but talk about this tool spreading quite rapidly, uh, especially, since we have access to it online. Okay. All right. Thank you. So we've got about a 50-50 there. And now I know where we are in this audience, and let's move forward. That's good. Thank you again for participating. Okay. So I'll jump into some of the basics. So AI, it stands for artificial intelligence, which Basically, it just means computer systems that can perform tasks that usually understand language, learning from data, solving problems. There, some AI is very basic, like just predicting text conversations, when it's kind of correcting your spelling, and when you're texting, it'll think about the words ahead of time and you can just choose those. It generates documents, or it even helps with some clinical decisions, which we'll go into. So AI can support OTs in a few ways. It helps, one way is for documentation. So it can help write notes faster by summarizing sessions or generating SOAP notes. And there's a couple of ways it can do that. If you're working in a large hospital setting, let's say, or a clinic that has computerized, AI is kind of built into that. If you're writing your own notes and want to improve them, sometimes we can work it out in, like let's say a Word document, and AI can help us that way. We copy and paste. It can suggest goals or interventions based on input you give it, and in more of an administrative way. So some of the systems help with scheduling or predicting which clients, for example, might need extra support based on some data that's been entered previously. And sometimes AI can help our patients directly, like if we are having them use different apps that recommend exercises or track habits or behavior over time. And there are so many of those apps, right, that are out there that are free to them. So some common misconceptions and limitations. All right, number one, AI doesn't replace therapists. It's a tool, not a decision maker. That's probably the number one biggest thing that we can remember is we are not going to be replaced. It might replace some professions, but it won't replace us. You still bring the clinical reasoning and expertise. AI isn't always right. It works based on patterns, and sometimes those patterns are biased or outdated. So again, we have to see ourselves as the experts, the boss, the one who always verifies and reviews to make sure that it makes sense with us. And AI needs clear input. So the better input that you give it, the more specific, then the better output that you'll receive. So these are called prompts. So the the more precise prompts you give it, and then you'll get a better output, and you're going to guide it with your expertise by doing that. And finally, AI, it doesn't understand context like humans do, or like OTs do. So supervision and judgment, again, are always necessary. We cannot leave AI unattended and just use the response out of the gate. So some of the limitations is that, there is no personal touch. So AI cannot replicate the emotional connection or empathy that therapists provide during sessions. So, and sometimes that's fine. But again, that's one of the things that we bring, is that human reason for people wanting to engage in therapy, in change, in whatever it is. So some things AI can do on its own, but our relationship with patients cannot be undermined by AI. Also, some data privacy concerns. An important thing is never enter personal information or personal identifier information in there, because it just goes out to the field. It goes out to who knows where it goes out, but we want to keep that out of there. And then again, AI doesn't know everything, so it can give you wrong information, and you want to pay attention to that. If you're running a clinic or want to start a clinic and want to have some of those electronic health records and scheduling systems, there's some cost barriers in that. But as individuals, it would be cost prohibitive for us to incorporate those things. But some of the AI tools I'm going to share with you today are fine. So in summary, AI, great, offers incredible opportunities to enhance patient care through efficiencies. But we have to approach it as a supportive tool rather than a replacement. So there we go. By understanding this, we can use this responsibly and think about how it can help us. All right. So I was thinking, well, what types of AI are there? And so I thought, excuse me, that I can make it into four categories. One is reactive AI. And basically, an example of that would be virtual assistants like Siri or Alexa. And as I mentioned earlier, earlier, autocorrect and documentation. So that's one of the ones we're most used to. Another is generative AI, which I use a lot. An example would be ChatGPT for writing SOAP notes. And another, Dolly is pretty popular for patient education visuals. So this one kind of creates art based on some prompts. Another example would be predictive AI, and that is, for example, predicting risk of hospital readmission. If there's a large database like an electronic health record, it will pull in all this information and say, oh, this person right here, given all their labs and vitals and history, they are at risk for readmission. And in some of those cases, then you'd be able to, you, the team, would be able to say, oh, we should act ahead of time before they're discharged and see if we can mitigate or address some of those risks. Let's see. Another example that we would see at home would be fall detection alerts from wearables. And also those ones that give us the watches, let's say that give us the oxygen and it gives us heart rate and all those, so we can kind of monitor what's going on with their health. And then assistive AI would be another one. And example is the AI-powered scheduling tools and apps. So when we think about what kind of AI might be helpful, you need to think about your purpose. So that's why I like categories, because I use a lot of different apps. Not like ChatGPT only works for me as a thought partner. It doesn't work for me for clinical stuff. So that's what we want to think about, purpose and the different types of AI. Okay. So here's an example for coming up with treatment ideas. I love AI and Perplexity. There's a handout of a bunch of the different tools and what they might be used for included there. All right, so it can help you come up with relevant treatment ideas. I think that's the biggest thing that I find that's helpful, is that I can input things about the person. So let's say you're working with a kid who enjoys football, but they struggle with attention and following routines at home. And so, I can ask, I am working with a kid that loves football, but and can you incorporate some activities that he might like to do that will address his issue in terms of improving attention? And so it might give some suggestions, and it might say things like making a visual routine chart using papers and football stickers, creating a game where each completed task at home earns points towards extra playtime. Well, wait a minute. What if I'm not into the reward system? What if clinically I don't believe in reward systems? I really want to go for intrinsic motivation. Well, then I can say, how about please reformulate, but instead of using a reward system, focus on things that will build his intrinsic motivation. And then it will change. It will change the recommendations for me. So this is what I love about it, is that it's quite responsive, it's quite quick, and I get to shape it. So that's my favorite thing. And these are things that I may not have come up with. And it can be way more creative than me, because again, I'm stuck in my clinical mind. I think about only things that have to do with what I know, and it knows a lot. So this is what I really, really like about it, personalizing the care plan. Here's another one. Imagine that you're working in an outpatient clinic and you have a high caseload, and you want it to help you write a note, let's say. So you can say something like, and I've tried this on ChatGPT. I can record what I'm thinking, and then it writes up a note for me. So I could say, let's say, client worked on upper extremity dressing with minimal assistance, practice reaching with affected arm and use adaptive strategies. had good engagement, but needed verbal cues to stay on task. So I'll speak that or even enter it into the AI tool, and I'll say, please generate a SOAP note based on that information I gave you. And it cleans it up. So it might say something like S, client reported feeling motivated to improve dressing skills. O, participated in 30-minute OT session focusing on upper body using affected limb, required minimal assistance and occasional verbal cues for attention. So it goes on. It cleans up my basic language and it puts it in the format that I ask it to. So this is it's very useful in those circumstances where you can kind of create that and copy it, paste it in whatever documentation you're using. And it's even great if you're writing notes, but you want to improve how you write. So it helps you. And it trains you. Once you start doing it for a while, it's like, oh, okay, and you can clean up how you express it. But the best thing is you can just say it briefly and it will clean it up for you. So it saves time, gives you structure, helps keep your notes consistent, but you still have to review and edit it. So you're the one who knows the client in the context. So you have to be the boss. And remember, whatever you put in your documentation, you're responsible for. So you make sure that it's accurate in expressing what you want. It can be very helpful for you. Okay, for at-home exercises, one of the things is we know that people don't like to do their home exercises. One thing is, it's no fun. Thing number two is that maybe it's not meaningful to us. Maybe we're not interested in it. So I find this is great. And I will also work right with the family or the client to double check and say, let's come up with something that will be specific and help you. But I also want it to be something that you want to do, something that you think is interesting. So we can use AI right there if you have access to it, and several of these you can use on your phone. So you want to give information about the client, their environment, and how they communicate. So kind of those 3 points, but not personal, information, just a little bit about them. So you can say maybe their interests and capacities. What do they enjoy? What are their abilities and challenges? For example, my client enjoys gardening and has mild left side weakness after a stroke. You want to talk about availability of resources. What material, space, or technology do they have access to? For example, she has a small backyard and no special equipment. Language preference and understanding. What language or reading level do they need? So she prefers instructions in simple English, or, if they speak some other language, then you'd want to, as a first language, then you'd want to put that. The AI is very good at translating and speaks a lot of languages. So by including this information in your prompt, AI can generate a home program that fits the client's real life context. So not just generic exercises. You can ask them what type of equipment that is commonly found in a home could be used to complete these exercises. And AI will come up with a list of all kinds of things with common household equipment. And you can verify that with your client right there. Do you have these types of things at home? And it makes it a lot more doable. And then they become part of that plan. And that always helps them to follow through. Okay. So this little image on the right is a little difficult to see. And hopefully if you look at the slides later, you can see a little bit more of that. But this is a screenshot of Perplexity, one of my favorite tools, and here's why. I can ask a question. So let's say you're about to see a client, a kid, and you want to know a little bit more about DIY floor time, for example. So you can just say, what are the principles of DIY floor time? The great thing, and this is just a screenshot, it's got a whole lot more, it maybe had 8 things, I think, 8 principles, something like that. So this is why I love it. You ask it something like that, and the first thing you see is all the resources that it searched. It's very clear, transparent in where it gets its information. And it gets its information real time. So it hits the internet, which is different from ChatGPT. ChatGPT has all of its information sort of uploaded up to a certain date. That means people, whatever they know, they choose to upload the information, and it may not be, what you need. But this one scours the internet and scours uh, the some some studies. So we can rely on it a little bit more. And then you can go verify that information to make sure that it's solid, that it's a solid source. So this is one of the things that's awesome. We don't know everything about everything. So it's nice when we have a clinical question, I say, go to Perplexity, and it will give you a really good start and some great resources to look up. The other thing it does is it also rephrases a question for you, and you can maybe ask it in a different way. All right, I'm going to show you a very quick video about consensus. It's one where I had an example already, but you can see what that looks like.
Consensus is an app that helps you find and summarize literature quickly. Toggle on the synthesize and copilot features to get the most from this app. Enter your search query and click the search button. The app will provide a summary, and Copilot provides a brief synthesis. The current source material used in Consensus comes from the Semantic Scholar database, which includes over 200 million papers across all domains of science. Copilot provides key insights, organized based on the search query regarding benefits and barriers to incorporating client-centered principles, and added facilitators for implementation and a conclusion. This structure can be helpful to create the lesson content. Consensus lists the articles it found and gives a brief snapshot of the content, source category, authors, how many times the article has been cited, and the year published. It also identifies the type of study and other features. If you click this summary, you'll be taken to the full text of the article where you can see the abstract. Because the article is from Semantic Scholar, you can download the PDF to include in the lesson. You can also see where this article was cited and the references used in this article.
Okay. So consensus, again, I love this. I made this as an example for some faculty. But when you have a research question, you can go in there and ask it. And the thing I love about it is, again, it shows you a bunch of articles where it got this information and it summarizes for you. And you can download, you can get the articles in a PDF. And this is a wonderful way to find out, to get evidence in places where we don't have access to it. So I'm a big fan of Consensus. It does limit you in the free version a little bit, but I have the free version and I'm perfectly happy with it. So play with that when you get a chance. Okay, so we are going to do a case study. We're going to do a little breakout. And this is your time to think about how you would apply it. Remember, when we're learning information, we need to have a use case. We need to think about what things can do in our setting with our interests and the type of clients that we work with. So here's an example. What you're going to do is you'll go into your groups and you'll talk about this case. So a community-based OT is working with a child who has physical disabilities, including, you can see there, reduced trunk strength. They have difficulty sitting during meals. So you want to come up with adaptive solutions to help improve this trunk strength using common household materials so that they can sit up and engage in self-feeding. So I want you to, if you can, talk about what type of prompts you want to use, which AI would be useful. And if you have access to it, it would be awesome to in your groups, input some information and see what it tells you. And then we'll come back and talk about it a little bit. I'd love to hear what you think of it, and if you had a chance to input information and play with it a little bit, adjust the prompts. Okay, I think we're ready for our breakout.
Great. Thank you so much. Kelsey has put everyone in breakout rooms. Please remember to keep your camera on while you're in the breakout rooms to help facilitate the conversation. Thanks, everyone. Great. Thank you, everyone, and welcome back from the breakout rooms. I hope you had a great discussion. I'm going to go through some of the questions that we had, and I'll just call out the facilitators. So the first question was, how would you use AI to approach this case? David, do you want to start us off? Oh, you're on mute, David. Oh, we still can't hear you. You know what? I'll circle back to you. Adonis, do you want to start us off?
Sure. Well, we discussed that we would start with consensus AI and that we would ask it to create activities for children with physical disabilities with feeding difficulties.
Great. Okay. Ria? Looking for your name here. Who else was in that group? Evidence, do you want to talk about your group?
Okay. We would approach it asking about activities that will help with improving posture and stability, and also improving the drug control of the client.
Okay, great. Potian, does your group have anything else to add to that? Oh, you're on mute. Sorry.
Sorry. So I think we had quite similar of what we discussed, and we also had to have the same idea instead. And someone said consent of what we need to look at. So we had the same idea on the first question.
Okay, we'll move on to the next question, which was, I'll start with Tobiloba, if that's okay. What prompts would you use to generate helpful solutions?
All right. So someone in my group, they used consensus, and then she went further to, the question was, you are a community-based occupational therapist. So she went further to ask AI in a native language the question, and then we had a barrier, we had a limitation. AI could not generate, in quotes, the answers using a native language. So for now, I think the only language AI understands or understood is English language. And yes, so many of us here, we are Africans, and to explain solutions or treatment plans to our clients, sometimes we just need to use our native language, but AI is a bit limited in that aspect. So she used consensus, and then we went further to use ChatGPT too. And yes, we got the answers, but our languages are not there yet.
Gotcha. So you had to say it in English and then you would have had to translate it back for your patients, or?
Yeah.
Gotcha. That's a neat. I love that you tried that. Thank you for trying. I don't speak any other languages, so I am not able to try that. David, you want to try to answer that question for your group, the second question?
Can you hear me, Kate?
We can. Awesome.
Okay. The second question, basically what we said was we would look at the case study and pick out the most important points from that, the description of the child, the description of the problems, and we would focus on the fact that it's household materials that we need to use. So the prompts would be they come from the case study.
Okay, great. Thank you. Budhika, does your group, you and Abrar, do you have anything else to add to yours?
Yes. So in our group, discuss about some adaptive solution as adaptive spoon, adaptive feeding cup, and also the maintaining posture with some adaptive special chair using Velcro and magnetic tool. And also when in the community, some translate tool to translate language when access different languages.
And when you talk about the different languages, were you guys able to translate anything Did you try that?
Yeah, so in our country also the some region speaking in the different languages. Yeah, so then we have to use some translate tool and also help of the some translator sometimes.
Okay, thank you. Well, stay on. I'm going to have you first for the last question. So the last question was, what are the limitations and ethical considerations of using AI in this situation?
Yeah, in our group, discuss about that when using AI, the difficult to assess cognitive level and emotional feedback of the client, and also have to come across with some cultural barriers, cultural problems, and also when have using some AI that machine some emotion when we have a dialogue, so we can get the real feedback sometimes.
Okay, great. Thank you. Adonis, do you have anything to add that for your group?
Yeah, sure. We talked about plagiarism, about privacy issues, if using too much personal information from the patient, and also that we should not replace the clinical judgment with the AI.
Great. Potian, does your group have anything to add to that?
We also had to say in the language barriers because we normally use English once we are asking AI, and the translation to our local language could be a challenge, not be having the common understanding when you change the language. So if we translate that from English maybe to Swahili, and then when we get someone who is knowing both Swahili to English, it might lose the meaning. So language barrier, we saw it as a challenge.
That's great. I really love how the language piece is coming out today. AI is fairly new for me, so I'm learning a lot today. Tobaloba, did your group have anything else to add?
Oh, well, nothing really. But then, even so many of the answers that the AI generated um, in the rural area, they might not be able to get their hands on the material stated in the answers. For example, they talk about a rubber, I forgot, a rubber stuff that can be placed under the plate so that the plate will not slip while the child is eating. So the rubber stuff, we might not be able to get it in some part of Africa. So materials, getting our hands on materials can be a challenge to even if AI provides the answers and the treatment plan, but getting materials can be a limitation too.
Yeah, resources are very varying depending on where you are, for sure. Dr. Duddy, I'm going to turn it back over to you. Did you have any questions or summarizing points that you wanted to ask the group? I feel like this was a neat experience for many of us.
Yeah, it was very neat. And Tobaloba and others, I am thrilled that you were able to try it out and really explore some of the language limitations in these AI apps. And it really reinforces what we know about how they got invented, which is the material that goes into them is it's from whoever the inventors are. So we're not going to have really culturally informed AI until more people who are contributing to these AI models get their voices heard. And that's going to be a very important piece of that. And if you think about how AI has really kind of come about and full speed ahead, it's because people are playing with it and they're asking for or demanding AI to do certain things for them. So the more we get involved with it, the more we say, I need it to do this, it will hopefully transform in those ways of being helpful, helpful to more of us. There are some big models coming out of other countries, like Russia has DeepSeek. I'm sorry, China has DeepSeek, and they've been able to really make this incredible model at a lot lower cost and using a lot less energy because they're kind of duplicating a framework that was built for some of these other ones, and now they can add to it. So we're going to see a lot of, and I think that one has a lot of more languages supported. But you always have to be careful about what information and everything that you're putting in, so people can get wary based on who the maker of these models are. But anyways, it's important to think about what you're using and how it works for you. Being able to translate it back and forth is, it's a really good idea. But yes, you are going to miss something in the translation, and that's where your expertise comes in. I like that you played with consensus. That's fabulous. And with that one, the more you're able to give a precise research question, it will the studies that come up will be more relevant to what it is that you're looking for. So sometimes you can use something like Perplexity or even ChatGPT to say, can you refine this research question for me? What I want to know is, can you make a good research question? And then take that research question and go over and plop it into consensus and try that way. So
Great.
combining them for different purposes is great.
Great. Yasmin, did you want to add a quick comment?
Yeah. In our group, we discussed on limitation of AI that specifically with this client having tone problem, as a therapist, we only assess her or his tone. AI can't. So, and also the human touch will be missed with AI. Whatever we give information, that only we can get. So yeah, it should be used in a balanced way.
Thank you. And Evidence also wanted to ask a question from her group. Evidence, go ahead.
Okay, a question was asked if it's possible to upload a photo of the clients without including their faces, and just asking, is this for instance their postural difficulty, just what's the solution, what can be done? So is it possible?
No, I'm not sure. I'm not. Can you ask that again? So it's asking them a question without using their faces. Are you talking about your clinical observations?
Yes, including their photos, the way they are seated, and in terms of the question that was being asked, their difficulty in trunk control, and you just take the client's photo without their face, and then ask the AI for solutions that can be done to improve their trunk control. Because yes, seeing a picture of how it's supposed to be or how the patient is being seated.
I love that question. And that came up multiple times in the United States conference, last week. That was a great question. I am not aware of any AI that can do that at this time. There are other apps like kinesiology apps where you put little markers on people and you can you video them and it will kind of assess movement. So there are those type of apps that are already in place, but in terms of taking a picture and uploading it to AI and asking it to kind of clinically assess that, not that I know of. So the nuances, that's where your skill evidence really has to come in. I think of it like a radiologist, right? So the X-ray takes the pictures, but the radiologist has to interpret what it means. And I think regular AI is still in that place. It doesn't understand what it's looking at. So your clinical knowledge will have to come in. We do it in sometimes we'll have virtual distance therapy. We'll have someone take a picture of a person and different things, and then they'll upload it to an expert, let's say, and the expert has to review it. But right now, no, not yet. If anybody hears of it, I'm dying to know.
I think there is a Gemini AI, which you can even like get your photo, like you can see yourself there, and you send a photo. For example, describe this photo. It will describe the way it sees you. For example, to say that you're wearing a blue shirt and eyeglasses. It will tell you that. If you upload the photo, it will give you that answer. And you can even give it a document. It will tell what you want it to do on your document. Maybe it's a case study, or it's a document you want a summary or to analyze it. It will do it.
Evidence, that would be a fun way to test it, is to take a picture and just ask it, see what it says. I'd love to see that. Models could be trained to understand what it's seeing, but it would take a lot of training for clinical training. Thank you. Those are really great ideas.
Thank you very much.
Well, thank you everyone so much for being here today. This is a great discussion. As a reminder, you need to fill out your post-survey and your pre-survey in order to get a certificate of attendance. And we will hopefully see you all next month. Dr. Duddy did have a handout that she uploaded to the OT Echo website that has a whole list of resources for everyone. So please check that out. And her PowerPoint slides are there as well. Thank you so much. This was great.
Thank you, everyone.